What's up, guys? My name is Dr. Daniel Kaplan, and I'm back with another video. Today's video is all about internet gaming disorder. This potential diagnosis has some controversy, which you'll learn all about, but we're going to compare it to substances of abuse as well as gambling disorder, and we'll see where we land. So if you like this video, give me a big thumbs up, hit the like button, subscribe, click the notifications tab. But without further ado, let's talk about internet gaming. So I want to start my remarks with a preface. The DSM-5 has placed internet gaming disorder in the conditions for further study tab. That means it's not yet in the DSM. So it's in the back pages where we need to explore more, very similar to what we said about caffeine use disorder. And the question is whether or not it is an actual disorder. So some people argue that adding internet gaming to the list of recognizable disorders could help millions of people address their addictions. However, other people criticize the concept of internet gaming disorder and say it's not its own condition. And in fact, it's an underlying problem or symptom of something else like depression or anxiety. And then a third major criticism is that, look, people like to play video games. And if they're playing video games and getting everything else done, maybe we're going to pathologize normal behavior. So this is kind of where the literature is. There's a major debate on it, and the DSM could not resolve this debate by its publication time. So nevertheless, they did offer 9 criteria that would be in a proposed diagnosis. So if it was actually added to the DSM, we would have to have some sense of preoccupation, some sense of withdrawal to the game, some sense of tolerance, some sense of failure to reduce or cut down or stop playing the game, sacrificing other activities to play the game. We also see them continuing individuals to play the game despite problems. They might hide as much that they're playing it as much as they really are. They might do it as a coping mechanism, and it's possible that they could lose or risk relationships that are important to them. Now, you might say, well, in the last video, you talked about gambling disorder. What's the difference, right? We did talk about online gambling. Well, this, if it's going to get into the DSM, is going to stand alone because the internet gaming disorder that we're talking about has no money at risk. So that's the distinction between internet gaming disorder and gambling disorder. Now you'll see what's interesting is the features of addiction remain the same. So if we go back, things like tolerance and withdrawal, preoccupation, failure to cut down or stop, all of these symptoms were within the understanding of addictions. So the argument is that internet gaming is its own addiction. So under these criteria, you would need to have 5 or more symptoms within a year. As with all addictions, we track it for 12 months in order to see where it lands. And then obviously, the condition can include gaming on the internet with others or gaming by yourself. So you don't need to be in multiplayer gaming situation. So what's the common case? The common case is 8 to 10 hours a day spent on video gaming, which is upward of 30 hours a week. That is where a person starts to neglect other activities, and they might forget to eat or sleep. So they're foregoing basic aspects of health. Now, what I will say is that this is a non-substance related addiction, right? So the ICD actually added gaming disorder alongside with gambling disorder as one of the disorders due to addictive behavior in 2019. So when they updated their manual, the ICD is more of the international classification system. The DSM is more US centric. They added these conditions. So there's more to be studied, and the jury's still out whether internet gaming disorder will be included in a future DSM. So I hope this video was helpful. I hope that you were able to learn the difference between internet gaming and gambling disorder. I hope you were able to see some of the similarities between substance use disorders and internet gaming disorders. I hope you were able to determine the difference between how the DSM handled this disorder and the ICD handled this disorder. So I hope this was helpful. Once again, help me bring this video to a larger audience. YouTube algorithms count the number of likes, subscription, notification clicks. So if you could do that, that's wonderful. But aside from that, I'd rather you write a comment. If there's anything you learned from the video, if there's something that was thought-provoking, a question, I read every comment, I respond to every single one. So please put something in the comments below, and this will help us turn into more of a learning community. Until next time, take care, everybody.